With a hidden camera, we entered the Kenyatta National Hospital, and an unusual silence prevailed on the corridors as doctors deserted the facility, forcing patients to seek treatment elsewhere. This is the end referral facility in the country and across the East and Central Africa region, and undoubtedly the busiest hospital. Clearly, the crisis facing public healthcare delivery system in the country is deep. The casualty section, which is usually packed to the brim, was today deserted. Sometimes patients have to share these beds. The pediatrics and the surgical wards were unusually spacious, with some doors locked. The management, however, insisted yesterday that despite the nearly 400 doctors who are undergoing postgraduate training known as registrars going on strike, the hospital was still effectively operational.
We have gone ahead to have several doctors on locums. We have recalled most of our consultants from leave and also others on other assignments, and they are working 24/7.
As it is, pretending that the things are normal is actually burying one's head in the sand. If the whole team is not working, then you are not going to.
Huduma itaendeleaje kama madaktari 400 juu ya 600 wametoka hospitali? Utaendelezaje huduma? Sasa kile ambacho inaendelea ni kama experimentation.
Obs Gynae is one discipline that is all emergency. You cannot prescribe it on the phone.
The consultants say the government has missed the eye of the storm, which is in the country's sick healthcare delivery system, and not just the registrar's complaints over pay.
One can actually say that the Kenya's healthcare system is broken. It's broken because of supplies, it's broken because of equipment, it's broken because of infrastructure.
The healthcare system in this country is one that encompasses all the 6 building blocks according to WHO, where you have the correct workforce, you have equipment, you have information, you have governance and leadership. According to me right now, we lack that governance and leadership.
Those are priority healthcare issues documented in the Musieme Task Force report, which the government undertook to implement. But doctors are now concerned that this was just an empty promise.
The Minister of Medical Services in the entire health sector, in his entire 4 years, is concerned with one thing and one thing only: implementing the new NHIF rates. And we're asking him what for? You want to collect more money to take to an institution that has no drugs, has no gloves, has no facilities, has no equipment, now has no doctors, and you're still busy collecting more money.
Consultants in various parts of the country were said to have held meetings today to plan their next course of action.
As a union, we have not received any orders that are saying that the strike should be stopped and have not been served. So we are still going on with the strike, and we have said on Monday, come Monday, if the government is not going to address these issues, then you're going to have all doctors in the country, including consultants, joining.
One of the things that has been very commonly misunderstood is that since the December strike, Kenyans are of the opinion that doctors sold them out for 30 pieces of silver in the form of 30,000 shillings of allowances. But we are here today to say that this is actually not the case.
And as the consultants planned to join other doctors on strike, there was talk at Kenyatta National Hospital's corridors that even the nurses would down their tools come Thursday next week. If indeed all the healthcare providers in public hospitals make good their threat to stay away from hospitals to demand proper healthcare delivery systems in the country, some patients may have to pay the price with their lives. Sylvia Chebet, Citizen Weekend.